Thank you everyone for joining us for today's webinar. My name is Faustine Chan. I'm the Business Innovation Manager for BB serving the Pacific Southwest. We've been holding webinars. We actually just switched it to twice a week now. We rebranded it to Ignite Your Mind. So thank you for joining us. I want to go ahead and toss it over to Marquise Jackson. He has some information to share about the SBDC as he's a regional director, just some tools and some helpful resources for all our business owners listening online.
Thanks, Faustine, for that. So as she said, I'm Marquise Jackson. I'm the regional director for the San Diego and Imperial Small Business Development Center. I'm also a board member for the National Association of Small Business Development Centers. For those of you who aren't yet familiar with the SBDC, I highly encourage you to visit us. I'll give you a little bit on the SBDC here, but just I want to encourage you to take advantage of a resource that exists. So the Small Business Development Center, no matter where we are, we really provide two key services for you as a business owner. If you have a business and you have challenges, whether that be HR or marketing or getting access to capital or just business continuity, you can sit down with someone from the SBDC one-on-one, and we hire current experts, or either they're current business owners, previous business owner executives, or specialists. I'm kind of like Analia, who's an expert in the HR field, and they'll sit down with you one-on-one and really coach you through any challenges that you have. And the second thing we do is a ton of education through workshops. It's better to take a group of people to a destination together sometimes because we learn from each other when we have questions in common. So I just wanted to give the quick SBDC commercial. If you're not located in San Diego and you're in Arizona, there is an SBDC there. You can go to our national website, americassbdc.org, and it'll there's a little zip code tool you can put in to find the SBDC closest to you. So thanks for entertaining that. And I'm going to pass it back to Faustine so we could get it all going.
Great, thank you so much, Marquise. This webinar is being recorded, so if anytime you do miss any part of it, we will have it posted for you on events.bbcommunity.org. So if you do have any questions for Analia, please go ahead and use the chat option or the Q&A, and we can answer them throughout the webinar. So Analia Corrales, she has worked in the human capital management industry for over 2 decades. She serves as a business advisor for the San Diego Imperial SBDC network. And she also has experience in every aspect of human resources, payroll, and benefits. She uses multiple HCM certifications to create real-life solutions for all HR problems. With a unique lifestyle of humor and depth and knowledge, she has worked tirelessly to educate small businesses in human resources. So please welcome our speaker today, Analia.
Hi guys, how's everyone doing? Greetings from downtown San Diego. I wanted to put something sunshiny in the background, and sun does usually shine in San Diego. I wanted to welcome all of you, and if you can take a second to please go into chat and let me know how many employees and what area you're located in. As we go through the content of today, we joke around a lot that even moving between counties when it comes to these HR rules in a COVID world can often require a passport. So I can try to focus specifically to the locations that you guys are located in and give you some more highlight and some more focus on what that's there. Also, your employee count will have some impact on some of the rules that we'll go through, so your employee count helps. I like running an interactive classroom, so at any time chime in. You'll see me ask you for stuff throughout, and at any time chime in via chat and just kind of let me know what your question is or what you're thinking. The rules are simple. If you don't want your name read out loud in a recorded WebEx, all you have to do is send me the message privately. If you send me the message to the whole audience, I expect that you're okay with your name being said out loud, and I will address you by name. I hope that's fair enough for everybody. So as we go through today, our main goal of today, so what I do all day, every day, pretty much for almost the last 2 decades, is talk to small business owners about anything and everything that they need to do to keep their businesses happy, healthy, sufficient, and profitable while being compliant in HR. Yes, it is possible to be profitable and fully compliant with HR, believe it or not. Today, we're going to focus on what HR looks like before and after COVID. We're going to look at a return to work checklist. And most important of all, I want everyone on this call to know that whatever problem I uncover that you have today, or whatever we're going to go over today that you feel you may not have, we have a solution for it. So we're not here to essentially poke holes at everything that you're doing and that you're missing and then leave you kind of like floating in the wind without those solutions. I am pointing out where some of your weaknesses are, letting you know that we have a way to strengthen those weaknesses under the SBDC umbrella and under the BBB umbrella. We're able to assist you in completing all of these compliances. So, you know, take notes, don't take notes and go back to the recording, but either way, know that if I'm poking, you know, at a problem that you have, it's because I have a solution, not because I just want you to feel really, really bad about that one HR policy you should have rolled out but didn't. Okay? So I think a good place to start would be to take a look at with what we should have had in place before COVID, right? So I know we barely remember a world before COVID, but I already had to work with people with HR. So these are the things that I would always ask them about. So as we start talking about your HR, this is where I'd start looking. How were your postings? How were your handbooks? Did you have job descriptions? Did you have a hiring process? Or did you just kind of hire what you needed? Did you have time off above and beyond what some of you, those of you in San Diego and those of you in California, were mandated to provide? Did you have safety policies? And did you have an idea of what best practices were? Some of you may have had all of this and been like flying smooth and had all this in place before COVID. Some of you may not have, or may have some of it, may not have had some of it. Some of you may have never heard that you needed to have some of this because you never ran into someone like me to tell you. So now let's take a look at what has changed because of COVID and what we need to go ahead and review and take a look at. Look, how magical. It is literally the same list of items that we're going through that we're going to need to update. So the good news for those of you that may have not had the most up-to-date job descriptions with physical requirements is that you would have had to have rewritten those anyway and would have had to have updated them anyways. So that's the good news for those of you who may have been feeling bad a slide ago about all the things you didn't have. This is your opportunity to build them. And like I said, we can help you do that. The most impacted areas in HR because of COVID are the most pivotal parts before COVID, not coincidental, right? So with the first thing is postings. Postings are vast of what we need to have now. Handbooks, did you have one? We would need to update it anyway. What were the job descriptions like? What was your hiring process like? What is your time off going to be like? And what is your safety going to be like now, whether you are already opened or are looking at reopening? What do all these things look like? And then, of course, I'd be remiss to not point out, and you'd have to have been without access to news for the last month, to not know that it may be a good time to review our discrimination and our harassment policies, because those were mandated prior to COVID, and of course now have an additional focus because they're on the forefront of most of your employees and most of your clients' minds. So let's take a look at some of these individually. Again, guys, ask questions throughout. I see your question about the long-term and the short-term impact, and I'd love it. So I'm going to continuously give you where I see and where I know the long and the short-term impact of these items are going to be. Okay, great question, Luke. Postings. With postings, I gave up on putting stuff on the wall years ago because it was basically just like a clutter of things. And then, you know, this company trying to sell me this poster and this company scaring me and telling me I was going to get sued if I didn't post this. And it was just entirely too much. Also, we were already a culture where not all your employees may have been in your office, right? I speak with some of you where you have 3 people in the office and 70 just rolling around doing other things. So where were they going to look at the posters? How could you prove that they had seen those postings? So pre-COVID, I had already shifted the concept of electronically sending the stuff to employees. Now, you don't need a fancy system. Yes, it's nice to have an electronic HRIS system that sends updates automatically. However, you may not have one of those. If you don't have one of those, do you have email? If you have email, you can provide the postings via email and have the employee acknowledge they have received the poster and that they know they can come ask you for questions about the posting individually. This actually, especially in the state of California, holds more weight than having it on the wall. Because if you have it on the wall, I may have not been into your office. I may have not walked into that corner of the office. It may have not been in the language you're instructing me in. However, if you send it to my email and I respond, yeah, I saw this, I read it, and if I have a question, I'll ask you, it becomes increasingly difficult for me to say that I was unaware of the law or the rule or the violation that was there. So my recommendation is certainly to have everything that can be done electronically, done electronically. We have all these postings for you. In the last slide, you get all my contact info. If you contact us over at SBDC, we'll go ahead and send you the link to all the postings. Arizona folks, I can send you that link too, because that link actually is federal. So it's the same, the CDC postings are going to be the same in California versus in Arizona, one county to the next county. Same holds true for the Family First Coronavirus Response Act. All those postings are federal. Ergo, they're going to be the same for every last person on this call, and we can email them to the employees. The employee rights and the paid sick leave also fall under that category. What does not fall under that category, which is why you see highlighted, bolded, in red, is the social distancing and sanitation checklist required by some counties. San Diego is being very, very strict on having this posted on every wall. Orange County has a suggestion on what you should have posted, and both of the Inland Empire counties, San Bernardino, I believe, has nothing, and Riverside has a suggestion that they want. In Arizona, I would have to go look up specifically what it is, but this is the one that's posted on the wall that says, I paraphrase, all our employees have washed their hands. This is how frequently we sanitize the bathroom. This is how frequently we sanitize doorknobs. This is how we are complying with the demands of the times, okay? Even if it's not required, I would, in some of the places that you're at in Arizona, I would consider posting something alike anyway, if you are safety conscious. So for example, if you're in a county, be it in California or in Arizona, that's not requiring facial coverings, but you're requiring of your employees, I would boast about that. I would brag that this is how it is to attract that particular audience and perhaps to require that they do the same. So just because some of you in Arizona may not be mandated to have these checklists, you may want to consider if this is something your particular business wants to do anyway or has reason to do anyway, okay? If there's any questions about postings, go ahead and pop them into chat. We'll address them throughout. And let's talk about the ever so present and fun employee handbook. Employee handbook is essentially all of the rules that you need to have for employees. So it's no surprise that it's been absolutely shifted and changed with COVID. I could literally do a 4-hour class, which I will not do so that you don't fall asleep, on what should be in the handbook. So instead, let's just hit a couple of highlight points. We can speak individually about anything else that you need and pop into chat any questions about policies that I'm not going to go over, and I'm happy to cover them or at least make an attempt at it. The policy you certainly need to have if you've sent anybody to work from home is a work from home policy, outlining the clear lines of what is work, what is not work, what is allowed, what is not allowed. Drinking in the office was, I'd like to think for all of you, never an acceptable practice during business hours. Should that hold true at work, at home as well? Or where's the line at? Where's your business establishing their borders? We'll make a note on safety later on the workers' comp element of it, but we start with having a policy of who is and is not allowed and for how long. You may be hiring a person right now that you intend to work in the office, or you may have a worker right now that you intend to return to the office at some point, but isn't returning now because of COVID. In this policy is where we outline, we always want to say until we change the policy, of course, but we want to add additional verbiage if we know it's short term. So if we know for sure that all the positions are going to have to come back into our office, our handbook policy should reflect it. If some will or some won't, our handbook policy should reflect it. And then we're going to mark that in a couple of other spots that are in the upcoming slides. Okay? If there's any questions about work from home policies, any questions you specifically have, any issues that you've had sending your employees to work from home, please pop them into chat and we will go ahead and cover them together. In the meantime, those of you who are working in the office and are not working from home do have mandates to protect an employee's health. You've always had these mandates. These mandates are not new. What they look like has shifted and has changed. So depending on where you are, it is mandatory, because this is, again, federal, that you do outline what measures you're taking. Yes, it is indeed true that San Diego is going to require you do at least these things, and San Bernardino is going to require nothing, but they're all requiring that you outline what they are. So even if the county is not saying you need to do these 5 things in order to keep your employees safe, you are still mandated to say, how are you keeping your employees safe? Are you washing hands? Are you sanitizing? Have you tasked certain people with cleaning areas? How frequently are those areas cleaned? What steps have you taken, like home shoring different employees? What are the areas that, what changes have you made or on your focus to protect employees' health? Okay. That's mandatory for everybody. You definitely want to reach out to us to get that updated if legal counsel or your HR person doesn't have a way to do it. Sick time has changed a lot. Again, if you have questions about that, pop them into chat. Sick time has changed a lot. Those of you in California were mandated to give 3 days. Some of you in San Diego are mandated to give 5 days. And we were already having these policies and having employees sort of like go to Coachella one weekend, and then the day after Coachella, I would always get, 15 clients calling me super upset that their entire staff is not there because they're sick. Being hungover to the client didn't felt like something preventable, and like they wanted their employee to come in. So this is the area of culture that we were in, and because of that, against California's advice, we were sort of saying, we'll come in anyway. Well, you're out of sick time, or, if you don't come in because you're out of sick time, if you don't come in, I'm going to discipline you. We sort of like pushed them. A lot of times because social media or our personal assumptions led us down the line that they weren't truly sick. That's gone, like completely. We've shifted our culture 100% to don't come in if you're sick. I believe this is going to have very drastic consequences in places like restaurants and high turnover. But before we get to those consequences, we got to follow what the law says. And the law says a culture of don't come in if you're sick. This has to be in our handbook policies, and it has to be in a bunch of other places. And it has to be upheld by our managers. We can't push people to come to work if they don't feel well. Even if the symptoms that they're giving are non-consistent with COVID, it's just gone. Sorry, guys. I know it was all you had in San Diego to protect yourself against sick, but this is not the way to do it. Secondly, your civil rights have not been suspended. If you've come to my workshops before, you've heard me chant that consistently. So you can check the temperature of your employees. You can require that they have PPE, but there are rules around that because their rights have not been suspended. So if you are you can require temperature checks for all your employees. You may be mandated to require them depending on where you are. But whether you're mandated to do it or not mandated to do it, it doesn't change. You need to disclose it to the employee. And you need to get the employees, you need to be able to prove the employee has approved it. We're moving to touchless systems. We'll cover a little more. So we'll cover a little more of how to track that they've approved it, but they still need to agree. They can disagree and therefore not work at your company, particularly if you're in San Diego, if you're a San Diego worker who refuses to wear a mask, there isn't anyone who can employ you because the city says so. So it's not necessarily that they're going to get away with it, but we do need to disclose to them, and we do need to get them to agree. And also back to the question we got a little earlier, for how long? Are we requiring this forever, foreseeable future, till the law dictates otherwise? Those are the verbiages that we want to have in our policies until further notice. It could be as simple as that. Until further notice, facial coverings will be required inside of our organization. That means one day you release a memo and you say, no more facial covering requirement, and change the handbook at that time. Okay? The hiring process and if you have any questions about sick or anything to do with the temperature checks, required PPE, we will talk a little bit more about that. So start putting those questions in the chat so I know in which direction to head it. Particularly if you're seeing a refusal to wear PPE by either employees or customers, and you're requiring them or required to have them. The new hiring process is also something that we're going to change in the handbook, but we're going to cover that in a different slide by itself. So I'm going to let it go. And the Family First Corona Rights Act also has to be in your employee handbook. This is literally, guys, a copy and paste job. If you don't know where to copy and paste it from, again, last slide has all my contact info. I'll be happy to send it to you. Honorable mention, when was the last time that you had your discrimination and harassment policies reviewed? If, you know, I hope you at least got it done when all of the Me Too laws came out in the last 2 years and became applicable within the last 2 calendar years. But even if you did that, you might want to look at them again, because it's something we definitely want to take this time to review. And it has changed a little bit in how we present the information, even if that's the last time you did it. Now, if you didn't update it for all of the Me Too laws that came out in the last 2 years, you're probably like 2 seasons behind on this Netflix show. So you absolutely want to reach out to us so you don't end up inadvertently not complying with the law, not violating the law, but simply violating the law by not having the proper compliance documentation for it. Okay. So I have a great question here from Cassandra. It says, we've had some issues with people working during their scheduled times at home, especially parents when their kids are at home during the day. Yes, we're all learning how to rebalance our lives and how to figure that out. And that has been challenging for everyone all around, for the employee, for the manager, for the HR person trying to make sense of what is happening. The best way to control that, Cassandra, is going to be through job descriptions. Job descriptions prior to all of this would have been the same answer that I gave you. In a well-written job description, like the kind we can help you write, the key functions that employee needs to perform in order for you to be able to afford to pay them their wage are clearly outlined. So that is to say that I make clear to every employee the 5 to 10, 15 things I need from them every single day. And if they do not complete those successfully, they could not continue to be employed by me because I can't afford to pay them. This isn't personal, it's business. Attached to that, we want to have the physical requirements for those roles. So for example, if I have something as simple as an outside sales rep, their key function is going to be to go outside and get me new clients, and their physical requirements are going to require them to drive. So to drive, we're going to need a whole bunch of things, right? If you just think about all the physical things it takes for you to drive, all of those items have to be there. So Cassandra, when they go work from home, even as that outside sales rep, of course, the physical requirements may have changed, but the functions have not. So we can begin to hold them responsible and have conversations about how we can still get those tasks done. Yes, it is indeed possible that your CFO is now doing your P&L with 1, 2, or 3 children on them, plus maybe a cat and a dog and a parrot and a great variety of animals. But the important part is that that task is still completed, because you still cannot afford to pay a CFO for not doing the P&L that you need them to do in this example. Okay, so it's job descriptions that are going to truly guide our ability to manage each and every one of our employees. With COVID, you'll notice my first bullet point is they've all changed. Why have they all changed? Because every single job now probably has some kind of COVID-related responsibility, whether they are expected to come in to put in their PPE early, whether they're expected to follow certain county guidelines about PPE, or they now have to sanitize their station, or they now have to allow their station to be sanitized. Every single job description's physical functions and items that they do has been changed. At least one bullet point has been changed in there. And we are starting to add, for good measure, this culture of don't come to work sick in those physical requirements, with very nice wording in there. Okay, so like I said, it's a culture change where we're basically now shifting to, if you're remotely kind of sick or think you're sick or feel you're getting sick, just don't come into work. If they're required to wear physical, any kind of facial covering or any kind of PPE, we're going to add it in there. Once again, I'd like to make note of the fact that your rights have not been suspended. Ergo, if an employee is unable to wear a mask for a medical reason, Guys, Americans with Disabilities Act has been there for decades. We know exactly what to do in HR if a person is physically unable to do a job. It's of course not as simple as I keep hearing in social media. Oh, just get a note that from your doctor saying that you can't wear a mask. In HR, that's not what we accept. In HR, we follow the same standard that we followed with Americans with Disabilities Act for decades because it has served us well. Inside of that Americans with Disabilities Act, if an employee comes up to you and tells you they can't perform any of the functions or in their job in the physical requirements you should have already told them that they needed, we have a form for that. In the state of California, it's a specific state of California form they take into their physician fills out in response to the employer with the specific limitations the employee cannot do. It's not as simple as cannot wear a facial covering. Some of them are coming back, can only wear a facial covering X amount of times or for X amount of days, or they're not going to tell you what the medical condition is because that is what California's Americans with Disabilities Act mandates out of employers. In our bordering states, particularly Arizona and Nevada, the form is different. And it becomes a physician's discretion to tell you, yes, they have asthma. So because they have asthma, you can only make them wear a facial covering X amount of time. In California, you're never going to hear that. You're simply going to hear only what you want to know in order to get the job done. I kind of like that from California because I don't necessarily need to know everything that's wrong. I just need to know what applies to me. Now, if you don't have a job description that doctor can look at and fill the form out on, then the doctor's just going to tell you all of the things that he or she feels the employee is limited to do. And that makes it tricky and complicated. So you should really have that job description before somebody challenges you and says, I can't wear that facial covering, that's too heavy and I can't lift it, or anything of that kind. Okay, so from an anonymous attendee, I have any problems with questionnaires for employees along with the temperature being taken daily? How much can be asked? And I've seen law firms asking about symptoms and exposures in persons with COVID, etc. Okay, great question. That kind of is in between all of the slides that we've been talking about. So the question is, what questions can we ask the employees? At this time, in every one of the states that's logged into this, we can ask them the basic COVID questions. As a matter of fact, we actually have to in the mandatory new Rehire Orientation we'll cover in a couple of slides from now. So the temperature being taken daily and the questions being asked, they have a right to not be submitted to it, as if to say, no, I will not have my temperature taken. However, you still cannot employ them depending on where you are. Like in San Diego, for example, you wouldn't be able to employ them. Outside of that, we'd have to look more specifically at the circumstance to give you what some of those areas are. But great question. It's knocked into the Q&A side, so I didn't see it right away. Okay, so back to so continuing on our job description, it does back to what it clearly outlines the responsibility of what we can and cannot do, and what the employee can and cannot do. And this is how we're going to promote them. This is how we're going to potentially have them shift jobs. This is how we're going to terminate them on what they need to do on a good day. Now with COVID, it's also how we mark who's responsible. So if we have a requirement from our state or our county or our city that things need to be cleaned, checked, or done every X amount of time, and they don't get done, who's responsible for that? Having that on the job description means that I can go discipline that person, and you're going to want to discipline that person for any failure to meet a COVID standard, right? Because what is it that you say? If you let it happen, then you're a part of it. And then as an employer, being a part of it means you're liable for it. So we definitely want to make sure that we outline these responsibilities, and then we follow up by saying, hey, when I said that you needed to wear that mask or that you needed to clean that, I really mean it. And here's your verbal warning, and continuing on. If you need help with discipline, look us up. We want to also update our time tracking. If you are, again, if you're in San Diego or California in general, you are either A, being mandated to, or B, about to be mandated to have some kind of touchless time tracking. What I mean by that is, since COVID in California has been considered a workers' comp case, even if you're not mandated to have a touchless system, those are the kind of items that you're going to be able to use later to say that they couldn't have gotten contagion. If I have a clock everybody's touching and 10 of my employees get sick with COVID, it gets pretty darn simple for that to become a nightmare workers' comp scenario. So we're moving to touchless clocks. I'm not saying you have to run out and buy a facial recognition clock. There are other solutions, including email, which they touch on their own phone and they send to you. If you need ideas and you want to know how to manage tracking with the systems that you have in place, that's what I'm here for. Give me a call. Hiring process. Any questions you have on that? Again, I think you guys get the drill now, so just go ahead and type them in. I do prefer chat because it's right in front of my face and Q&A hides. Passing papers affected. That's what they mean by touchless. So when we're talking about, and I love how Cassandra is just like flowing directly into my next slide with your questions, like beautiful flow there. The hiring process of those passing of papers, the governor of California, as well as all the legislations in California are leaning towards either having already mandated it, San Diego, or highly recommending it, and the state about to mandate them. The passing of papers is something that we have not wanted to do for a long time because we wanted to keep good track electronically. Now it's also become masked into this. There could be an illness pass through. So it's been a clear message that you are to use this time to go, quote unquote, paperless. In HR, paperless has some hair on it, haha. So we can have a conversation about what that looks like to you, how it needs to be encrypted, what you can and cannot do. And that will have a lot to do with where you are, what you're doing, and how many employees we're talking about doing, okay? So once again, great question. With the interviews, it's kind of the same thing. So the picture that we're looking at right now for hiring it's a heavily electronic picture. It's posting an ad online, having an employee have a way to respond to that application online, which gives you a great way to look at employees based on their skill set, right? Because you're just comparing skills to skills to skills. And then setting up remote interviews. Remote interviews are still highly recommended. I highly recommended them before COVID because they're a great representation of how much effort the person's going to put forth when they actually show up to your office without taking the additional time and effort to come into the office. So it can be a great pre-screening sort of scenario. And it's now become socially acceptable. So you could definitely have more of those remote interviews. The rules are still the same. So we do not comment on people's backgrounds. We do not say, oh, I hear a child, or was that a cat or a dog? Or I see a soccer poster. Does your son play soccer? All personal questions is still off the table. It has not changed. It just means instead of them being in front of us and potentially either violating a rule, once again, San Diego, or exposing yourself in a place that is peaking in contagion right now, like Arizona, it's a way to handle moving forward with your life. Okay, if there's any questions about interviews, feel free to pop them in, as well as remote application or any kind of paperless onboarding. The good news I have on this slide is expired documentation. So as you know, I-9s are required, federally speaking. So every person in this entire call that has any employees, those employees needed to fill out an I-9. This is how you certify that you're legally eligible to work in the United States at the time that you were hired by this particular entity. Well, the catch with that is that we're looking for driver's licenses and passports, both of which, if they happen to expire for you in the last few months, you would not have been able to get a new one. With that in mind, there's been a reprieve granted by the Department of Homeland Security, which is allowing HR to accept expired documentation. I do want to say that again. We're still getting the documentation for I-9. I know there's some misinformation on the internet, so I want to be clear about this. The I-9 is still required. You still have to have one for every single person that you pay. Even if you only have one employee who works for you part-time once a year, you still need to have that form, and you still need to have the documentation backing up that form. What we're saying with this reprieve is that you can gather that information electronically, and that if the document is expired, you're allowed to accept it expired today. Of course, you're not going to be able to keep it expired. Once things begin to, like DMV starts catching up and we start having more of that area, you're going to have to go back and refresh that documentation with a new one, okay? If there's any questions on the hiring process, or any of you guys are hiring and kind of seeing some trends or some struggles, please go ahead and drop it into chat, and I will go ahead and answer it. This is one that I've been getting there's two slides here that I've been getting a lot of questions on lately. And this is one of them because it's been making a whole lot of buzz with being an OSHA requirement. The rehire orientation is required by just about every agency and just about every one of your locations for different reasons. It's either being required for you so that your insurance company covers a potential claim, or it's being required for you by law, as in they will fine you if you do not do this. So how you will be quote unquote punished for not having this will vary by your location. The fact that you could be punished for not doing this is a certainty regardless of where you are. What we have done over at SBDC, because we were getting, I was getting flooded with questions about this, is we went ahead and fixed this for you. We created PowerPoint presentations for a management team and a PowerPoint presentation for the employees with all of the requirements that you need for that employee to be working right now based on where you're located. And then we add a couple slides for individual industries if needed, but for the most part, it's all the same one. And we either get online on Zoom with your employees, or you get online on Zoom with your employees, or you send it via email and you get an acknowledgement that they've received it, and it runs them through. Wash your hands. All things that you're going to look at the slideshow and you're going to be like, they've heard this 1.5 million times. They have, but can you prove that you told them that they had? And can you prove that you told them what your rules and your thoughts and your sentiments were about it? Probably not. That's where this new rehire orientation is. It updates them with all of the new policies by laws. We are going to conduct this in a touchless fashion. If your employees are already in the office, yes, of course, don't send them home for it. But for the most part, when we can, we're running them remotely. And it explains and outlines what you expect from them, as well as what the government is expecting from you, what the city's expecting from you, what anyone in particular, depending on who and where you are, has that. And then we obtain an acknowledgement. So like I said, it's as simple as we either jump on, so this is a very, very short meeting. How they've been running is pretty much a 5-minute presentation of all of the policies that they need to have, and all the different COVID related items. And then we leave it open for about another 10 minutes for any questions that they may have. And the bulk of the questions we're getting with those 10 minutes may not even be COVID related. So no matter where you are and you rehire orientation, if you have not already done it, it is required for you to address this somehow. If you have not addressed it, we're happy to help you address it. And if you have addressed it, congratulations, because this is a source of panic for more people that I'm sure would care to let you know about it on the chat. You guys are being awful quiet on chat. Anyone have anything to add or say as we start nearing the corner of the end here? Pop in your questions before it's too late. Safety policies is what I want to start closing out with. OSHA has not changed their minds. So I don't know how many of you have spent any time thinking about the safety in your business, or Cal OSHA or Fed OSHA or anything like that. So let me tell you what OSHA's goal is. So OSHA's goal in life and what they want from employers hasn't changed since, I want to say, 1976. So in about 43 years, it has not changed. They're expecting every single employer to take every reasonable precaution. So once again, every employer to take every reasonable precaution available to protect the health and safety of an employee. That has not changed. Of course, our world has changed just a tiny little bit. So while wash your hands or you're going to pass the flu was a training OSHA already had mandated for some of you and recommended for others, it's now a much stronger requirement. Because what we are all, quote unquote, afraid of, or better said, one of the things we're bracing for impact on in HR is, again, the fact that COVID is workers' comp without contact tracing. So it will be pivotal at the time if you are misfortunate enough to be in a situation in which one of your employees becomes ill with COVID. You're going to want to prove you were not negligent in how that happened. Even if they did happen in your office under your watch, I want you to have both the personal and the professional certainty that you did not aggravate that situation. that's what OSHA is expecting from you as well. So it's not just hey, I know this is what you want to do. That's OSHA's expectation of you. So yes, it does take the place of that orientation that we talked about in the previous slide, but it also takes place in living the policy. If you have all these great policies about facial coverings and don't enforce them, and all of your employees get sick, or one of your employees gets sick because you didn't enforce it, having the awesome policy is not enough. So we need to have both of the components. We need to have the component of being able to clearly outline later that we took every reasonable precaution by having a touchless clock, by having good job descriptions, by clearly outlining to our employees, wash your hands, and this is how often we sanitize things, by taking every reasonable precaution. That is how we don't have an OSHA negligence. If a terrible thing occurs and one of your employees does become ill with COVID, you're at least going to have an insurance that will cover it called workers' comp. And if you can show OSHA that you were not negligent, that it just happened, because things happen, and heck, it might have not even happened at your company because contact tracing is not the best right now, that is what we're going to need for OSHA. And that is the same thing they've always wanted, guys, whether like somebody was falling off of a roof or getting burnt in a kitchen or having a finger cut. It's the same thing they've always wanted. It's just changed a little bit. Great question about what are the safety requirements for workers' comp for employees working from home? That's almost like, oh, I'm like, I thought that was in my next slide. If you have not spoken to your broker, oh, it's my first bullet point here. If you have not spoken to your broker, this is the time to call your broker. If you do not know who your broker is, this is your time to get to know your broker. By what I mean by broker in this case scenarios, those of you who are in California are all mandated to have workers' comp, and you have a broker attached to that. Arizona is mostly like that, but you may have a different situation. This workers' comp insurance that you're paying is on the hook, if you will, for giving you some answers and giving you some programs and giving you some guidelines, specifically the guidelines around your specific policy. Let's say employers, just to pick a name. If you're currently being covered by employers and you've sent X amount of your workforce at home, what is employers requiring from you in order to cover that claim if a person trips or falls at home? The requirements may be slightly different from one to the other, and only one person can give you that answer, and that's the person getting paid on the plan they sold you, also known as your workers' comp broker. So it's time to get to know your broker if you do not know them. If you know them, great. As soon as we're done with this workshop, shoot them an email and be like, hey, do you have 15 minutes to talk about COVID coverage? And have them tell you what is and what is not covered. You're welcome to then call us so we can put guidelines around that and say to the employees, you cannot do A, B, C, D because the workers' comp person just told us those things aren't covered. So we're going to tell them they can't do it, or whatever we need to put in HR. But this conversation for workers' comp requirements starts with what does the carrier want from you and what are they expecting you to do? They should just be covered during work hours, but the catch is, when does the workers' comp carrier say those hours started and ended? Because the claim is not going to come to you. The employee is going to get hurt. They're going to go to the doctor. They're going to tell the doctor the injury occurred while they were working from home, and the carrier is going to get that. The carrier is not going to get your schedule. So did you have a preset work schedule? Did you have a work from home policy that said you can only work 12 to 4 and anything past 12 to 4 is not work? So if you show up at the emergency room at, let's call it 9 in the morning, well, there's no way you got hurt at work because it's too many hours away from your actual work hours. So we do define those in HR. Long question made even longer. We do define those parameters of what a work day is in HR. But workers' comp does help us by telling us when they will and when they will not cover our employee. Okay, great question. And then we have another great question. If a company finds out that an employee has been tested positive for COVID-19, is there a requirement in the number of days that the company needs to be shut down to clean? Great question, and a question I got from a client literally of SBDC literally just before we jumped into this WebEx. So it depends is the answer. And I know you wanted something probably a little more direct, but there is a process because we need to both protect the anonymity of the employee who's tested positive. Again, your rights have not been suspended. HIPAA is still in place. An employee has the right to have an illness and not disclose that illness. Of course, it is a contagion, so we do have a right to know who got sick, and that needs to be handled by HR and or very carefully. I understand some of you do not have a designated HR person or an HR department, so it feels almost insulting if I tell you punt that to HR. But the reality of it is very few limited people inside of the company are allowed to know who tested positive, and even less are allowed to divulge that information. We may have to, because we're going to have to tell everyone who was exposed, both for law and for good conscience that could have been exposed to that employee, but it has to be done pretty carefully. Now, as far as shutting down, a lot of that is going to have to do with the city that you're in and the regulations of their own health inspector. I know I've seen drasticness from just 14 days, from a 14-day quarantine after the clean. And then I've also seen just clean out, there's a professional specific cleaning, by the way. This is not just like any company. There's a full sanitization that comes in, and then within 3 days, the business can reopen. So that is going to be happening. Those dates are going to come from interaction with the health inspector, as well as your HR and your ownership, or just your owners if you're most small businesses. Great question. If there's anything else, please go ahead and pop it in there. Once again, I'm going to remind you, sanitization is somebody's responsibility. It's probably everybody's responsibility, and somebody's got to be held accountable for it. The person or people who are held accountable for it, we need to tell them, and we need to change their job description, and we need to get them to agree. If any of your employees do not agree to one of the new duties you have to add to them because of COVID, the easiest answer is just call me. If you don't want to call me, call another HR consultant or call a labor attorney. Just very tricky, and it's highly dependent on where you are. Illness and injury, illness prevention programs, you all needed to have them. Half of you probably didn't. Now you really need to have them because they're subject to larger fines. And of course, signs. If you are running a company right now, like you are, there are some signs you will have to put up that have to do with hand washing and items like that, above and beyond those CDC postings that we talked about in the first slide that maybe we don't need to post. There are signs that we do need to have, just like before we needed to have, in case of emergency, escape this way. In case of fire, don't take the elevator, take the stairs, which are over here. Now we've just added a layer of COVID to what we already had. Okay. So running up the corner on the end here, best practices. What worked before may not work now. So what has always worked, I would encourage you to rethink it before you use it again. Like I said before, classic example is sick. We would push people to come to work when we didn't believe they were sick, or where they were sick because they were hungover. That is not something that we can do anymore. We used to kind of just take doctor's notes before. I did have places that had facial coverings or had gloves that needed to be worn at work. And we may have just accepted a note from a doctor saying, please excuse Johnny from wearing gloves or from wearing a mask. It's not something we can do now, because before we may have had that choice. Now we probably don't have that choice. Best practices on when to terminate somebody for a behavior have also changed. When to deny somebody sick time or vacation, have all changed. So before you do what has always worked before, re-examine, like take its temperature, pun intended, and examine if it's something that you still need to have and that you still want to do. Okay. I have a question about, do I have employees sign a document that ensures that they're doing their best to follow safety guidelines? Yes, I do. And I'm going to do that great question. I'm capturing that in multiple places. I want to capture that in a what I'm calling a rehire orientation, where I'm telling them to wash their hands and not come to work if they're sick, and following all of those new guidelines. And that's broad strokes, that's everybody. Then I'm going to narrow it down to one individual person's ability. So if, for example, you run a retail store and a person's job has just become to stand at the front door and make sure everyone's wearing a face mask because you're in San Diego and it's being required, that is what I'm going to have them sign. A job description who says, before I used to say cashier, now it says cashier and stand by the door 4 hours a day doing this, and your physical requirements are this. Because there is a certain level of mental fortitude. I cautioned about this before they were required, and now we've seen the problems from it. There's a certain amount of mental fortitude required to tell somebody you cannot enter here if you do not wear a mask. And not all your employees are going to have that in their, it's okay that they don't all have it. You're going to need to require it from somebody. So you and I can work together, or you can work with the resources that you have to make that happen, because you do have to require it. But you also have to keep in mind, it's not everybody's personality. I'd have no problem standing in a door and demanding something from everybody before they walked in. Somebody next to me may not feel the same way. Okay, so again, great question. So this is your time. The last thing that I want to tell you before I give you all my contact info is a plug for, remember that, for think of the times that you live in. We've talked about COVID this whole time, but I've also done quite a number of workshops on equality and what harassment and discrimination look like in employment. It's in the forefront of all your employees' minds. So you would really be remiss to have an old anti-harassment policy, or to have an old non-discrimination policy, or worse yet, to not have one at all. For those of you who are public facing, meaning your employees are constantly dealing with people that are not your employees, I have them sign these policies in addition to the handbook, because I want them to really understand no one's allowed to yell at them. No one is allowed to call them a racial epithet or attack their religion or anything like that. It's not something I'm going to tolerate in my company. So I'm going to take the additional step of making sure they know that during the hire orientation. So when I hire you, when you first come on board, if you're facing the public a lot, I'm going to give you a separate policy. Yes, it's in the handbook. But in case you missed it and didn't read every page of the handbook, I really, really, really want you to understand customers are not always right. They're not just allowed to treat you poorly. They're not allowed to violate discrimination or harassment or bully you, or you can't control them as a business owner. You can kick them out once you see them, but that's all you can do. I would also drive home to everyone the escalation procedures. So I would drive home to all of them, hey guys, I'm here. And if you don't like talking to me, there's your manager, there's a director, there should be at least 3 tiers of escalation. Those of you in California, it's a law. Those of you not in California, it's a good idea that an employee who feels threatened, harassed, bullied, discriminated upon has 3 people that 3 job titles they can go to inside a company. Of course, if your company has 3 or 4 employees, this may not be a doable thing. But reach out to me and I can give you what some of the adaptations have been based on previous law and good practice. If you don't have this, again, at SBDC, we are very, very dedicated to equality for all. So if you do not have these and do not have access to these, or you need any help with this, we are more than happy to provide you these policies and help you comply with this, because this is obviously something we strongly believe in, because it's what makes HR go around. That's the point of HR, is you come to work and you get graded, judged, and promoted based on the work that you do. Nothing else. And our policies need to reflect that. Okay, so this is now your time. We're here to help you with, I'm HR, as you probably have noticed, or have logged off already because you hated HR. But I also have partners in marketing, finance, business planning, and other areas that are just like me, but have different areas of expertise. You're welcome to talk to any of us. If you're looking for me specifically, particularly if you've uncovered anything today that you don't have and you would like to have and you would like to have access to, you can book yourself directly into my calendar. You can shoot me an email, or you can also give me a call. But right now, this is your time. So are there any questions, any thoughts, any comments from folks in the audience?
So Analia, we had a question earlier from Luke. He asked, COVID-19 legislation is often crafted to be temporary. Are you aware of any long-term legislation or long-term effects?
I tried to address all those as we went throughout, Luke. If there's anything that wasn't clear, please pop back in. I expect all of the safety, or I have no reason to believe, and because of past history, expect everything that's been put forth in safety won't be rolled back, as it has to do with, again, OSHA's principle has not changed in the sense that they want you to take every reasonable precaution to keep an employee safe. Maybe 10 years from now, all viruses have been eradicated, so calling it a face mask or calling it a facial covering will be what's gone. But the keeping your employees safe, taking every reasonable precaution to keep your employees safe isn't going to go anywhere. Likewise with most of the other items. What I do want to take this opportunity, Faustine, to highlight again, is if you're hiring somebody right now, whom you expect to come work in an office at some point, do make sure like the offer letter and all of those in the job description and all those items make it clear that this is temporary, that as soon as able or as the business plan shifts or at any time, they could be required to come back into an office. Because if they're a new hire, in certain areas, particularly in California, if you don't lay that out, they could have an expectation that it's always going to be a work from home job. And then you would have a harder time terminating them simply for not coming into the office. You'd still be able to discipline if they can't do their job, but you'd have a harder time disciplining them because they didn't want to come back to the office because you didn't get their signature ahead of time saying, oh yeah, as soon as there's an office, I'll be happy to come to it. Great questions. Anyone else have anything that they want to say or add or comment? Or you're also welcome to whine about how terrible all this is and how much you didn't come into business to do HR. I mean, I hear that at least 3 times a day. I didn't get into business to handle HR.
Analia, are there any websites that small business owners can go see just sample job descriptions of what you discussed so they can draft up their new job descriptions correctly for their employees?
No, SBDC can help them craft them, but as far as like a blanket one, there kind of isn't, because if you think about the 2 biggest components of that, one is what is your client? What do you want that person to do? Only you know that. Only you know if you want your receptionist to fetch you coffee from Starbucks or sit there and answer the phone. The job's still receptionist, but only you know what those duties are. And then what you need to add to that is physical requirements. So with that one, no one can give you the other. And the one of the duties is really only yours. So while you probably can pop into Google and find some sample job descriptions of something, you know, you're still going to need to put some work into it. What we would recommend, of course, is come to us. We do have we have written, I've lost track of how many thousands and thousands and thousands of those I've written in the last 20 years. So we probably have something that can get you pretty close to where you're at. But you're never going to be able to get around the fact that what are you paying this person for? What can you afford to pay them for is always going to come from you, right? That makes sense? Yes? Am I alone?
Yes, thank you.
Well, chat's also being quiet. I'm like, did everyone fall asleep? I'm sorry.
I think that's all the questions that we have. I don't see anything else popping up. So thank you, Marquise, for joining us. And then also thank you for Analia for taking time out of your busy day just to share your wealth of knowledge and experience in HR. I think this webinar is very valuable for all of our business owners just attending today. This webinar was recorded, so everyone will receive a link of the recording once it's posted. We'll also send it out an email. And if you're interested in future topics, or if you would like to share future topics that you're interested in us covering, you can send an email to me directly as well. Thank you everyone for attending today's webinar, and please stay safe out there and healthy.